So let's begin the first session. The first presenter is the Vice Minister Kim Gang-nip from the Health and Welfare. You probably have seen his face through the briefings. And Vice Minister Kim Gang-nip is playing a really important role in the nation's battle against the COVID-19, and he has to respond to the emergencies. So we were not sure how many infected cases will be reported today, so we prepared a video for his presentation first. So we will watch the video of his presentation, but he's on his way here. So we will watch the video of his presentation, but he will be joining us for the discussion and the Q&A session. So let's watch the video of the presentation. The COVID-19, how Korean government has responded, how it can be evaluated, and the future challenges. Let's watch the video together. Good afternoon. I'm Kim Gang-nip, Vice Minister of Health and Welfare. I'm making this video 1 week in advance of the forum, so please take that in mind. So some of the figures that I will be presenting may not be up to date. So today, what I would like to discuss is the COVID-19 pandemic and how the Korean government has been responding. And in responding to the outbreak, I was a person who has been part of the National Disaster Countermeasures Headquarters, so what I'm going to share might have some insights for you. But I'm not an expert on infectious disease, so I may not be really good at explaining some of the details. And as I was preparing for this video, I was able to understand how hard it must have been for the professor this semester. First, let me give you some characteristics and effects of the virus itself. We have seen the many different strains of coronaviruses. In 2015, we had MERS, and before, we had SARS. And these are all caused by coronavirus, and they were viral respiratory diseases. But this time, the COVID-19 outbreak is a bit different from MERS or SARS. First, the asymptomatic transmission takes place, which was the most challenging part for us, because before, simply by checking the temperature, that you can isolate those with high temperature to prevent the further spread of the virus. But with the COVID-19, the 40% of cases were found out to be the asymptomatic transmission. So temperature screening, which used to be really effective for MERS and SARS, was not as effective. And speed of transmission was really fast compared to the past outbreaks. The several cluster infection cases were reported in some small confined spaces, and the mortality rate is also higher compared with the previous outbreaks. As of today, the 8 million people have been infected and 430,000 died from COVID-19. There is another characteristic. It may be just like for other viral respiratory disease, but everyday life and the control and the quarantine measures are in a trade-off relationship, which puts us in a terrible dilemma. So COVID-19 outbreak has dealt a serious blow to the global economy, so it recorded the -6%, showing that world economy has declined. And the major countries declared a state of emergency. And as you can see from the graph, as the virus spread to the US and Europe, that we might have to do further studies, but the virus infection cases are showing different symptoms and severity. The outbreak started in China, Korea, and some Asian countries, and then spread to Europe, the US, Latin America, and then circling back around the globe, back to Asia. But compared with the Asian countries, the mortality rate gets higher and there are more infected cases in the US and in Europe. So Korea's responses to the COVID-19, there might be the varying evaluations as to how well we responded. When there was the first infected case reported in Korea at KCDC, the Central Disease Control Headquarters was established, and when the national level was raised to serious, at the Ministry of Health and Welfare, the Central Disaster Management Headquarters was established. So we can say that KCDC was serving like a soldiers fighting on the front line, while the Ministry of Health and Welfare served as the logistics, providing supplies of weapons and ammunition. So the battle against the virus and the quarantine logistics support is dualized so that the KCDC can focus more on virus control, and the support, coordination, and alignment of resources were taken care of by the Ministry of Health. And when the national level was raised to serious, the pan-government headquarters were established and the local governments also began to be engaged in the national battle against the virus. Since this point, the Central Disaster Countermeasures Headquarters served as the control tower. And infected cases grow exponentially in Daegu since then. And throughout the process, that we have seen the new type of cases and from abroad, that response measures taken by the Korean government had been benchmarked by other countries. There might be the many different reasons as to why other countries benchmark Korea's measures. But even after situations have stabilized, the social distancing measures were used in Korea, and since early May, the social distancing shifted to distancing in daily life. Of course, there are many factors and measures to be evaluated positively, but it looks like we still have many challenges that are lying ahead. If we take a look at the sum of the figures by period, first, before February 18th, and when patient number 31 was confirmed from the French church called Shincheonji, the early cases were primarily imported from China, and the increase in cases were moderate. And out of the four national alert level, the national alert level was then raised to the second highest one, alert from cautioned. So what the government did at this stage is, rather than shutting down the borders, the various measures were taken to have the similar effects. And those who have to come into Korea, these were mostly the Koreans who were coming back from abroad, and these people were allowed to come into Korea by utilizing the special entry procedures, and we identified their locations, so we laid the foundation for further investigation, and also using the self-diagnosing apps, they can check the potential symptoms. And what we have focused was the increased the diagnostic capacity. That was the priority that we had in the initial stage. On the days when we had the most diagnostic tests, that we tested over 20,000 a day, and now we can easily test 10,000 people per day. And at the COVID-19 screening centers, that we have expanded our diagnostic capacity gradually. And even from the very early stage, briefing was provided by the Ministry of Health and Welfare in the morning and by KCDC in the afternoon to the public to address the concerns and answer the questions from the citizens so that the citizens can have the accurate information and make informed choices in their everyday life quarantined. So that's how we responded in the initial stage. And since February 19, the situation in Daegu started to get worse until March 12. Daegu and some in North Gyeongsang province were designated as a special disease zone. And what we have tried there is that at the facilities that are not clinics or hospitals, the community treatment centers were set up and the treatment was provided there. And the social distancing was observed strictly by the public. The community treatment centers have not been tried by other countries. And when we first thought of this idea, of course, we had a lot of concern and worries. But still, through community treatment centers, that we were able to provide the treatment for the 80% of patients who do not need the specialized and intensive medical care to get better. Because we were sure from the clinical data that they can be treated that way at the community treatment centers. And that greatly reduced the burden on the medical facilities that we have. So even amid the explosive spread of the virus in Daegu, such government measures played a key role in responding to the outbreak. And lastly, let me go over the period from March 11 till today. Infectious cases lately hovers around 30 to 50. So it is not the time for us to let our guards down. But even if they are not widespread, we do have seen some community transmission cases. So far, the suppressed economic and the social activities are slowly being resumed, and the quarantine measures are taken at the same time to prevent the virus from rising again. And the experts are warning the second wave of the COVID-19, so we're preparing for the potential second wave. And let me now go over the highlights worth noting in Korea's response to COVID-19. The first, Korean government adopted the breakthrough measures in a relatively flexible manner. And the governance structure is changed a bit. And if possible, the government tried its best not to shut down everything, but to take inclusive and flexible quarantine measures. And it was possible because we have outstanding and highly qualified healthcare professionals and advanced hospitals. And we also have advanced ICT, the information communication technology, and transparent and rapid disclosure of information, and mature citizens practicing social distancing strictly. All of these contributed to the successful implementation of such measures. And these were covered also in the global media as well. What we had was the massive testing capacity. So that was the strength that we were able to benefit from since the very early stages, that using the AI and using the large-scale preemptive testing, that we were able to conduct a lot of tests in the initial stage. And even if we do have some diagnostic kits and labs, the difficulty in reality is collecting specimens from people, from the suspected people, because healthcare workers had to change their protective clothing every time they take specimen from a person, and they have to ventilate the room immediately. So that's why we introduced a walk-through and drive-through testing station, and these were used a lot by people And that was how we increased the process of collecting specimen for diagnosis. And for epidemiological study and isolation, the GPS self-diagnostic kit and credit card information was used to identify the close contact of people with COVID-19. And the surveillance camera video footages were also used to track the contacts. And those who are in self-isolation were able to benefit from various apps to check whether they have developed the symptoms. And the community treatment centers also use the ICT to facilitate the communication with the healthcare professionals and the infectious disease specialists. So even if they are distant physically, the patients were able to get quality medical support that they need. And when it comes to the quarantine at the airport, that we did not shut down the borders immediately, but rather the Korean government kept our borders open to those who need to come into Korea. But to make it easier to trace them afterward, we identified the location of them and the address of them, and through self-diagnosis, that these people were able to check daily to see whether they have developed the symptoms. And secondly, our approach was quite flexible. The government measures should be predictable, and when they're closely related to the rights of people, they have to be clearly stipulated in the law. But during the crisis, for the sake of the common good, the laws can be interpreted somewhat flexibly and applied. So some of the new measures were able to be applied quickly. And case in point we have is the community treatment center. Under the current law, the first-class infectious disease has to be treated only at the medical facilities, but the law was interpreted flexibly so that at the community treatment centers that are not the medical facilities, that the patients, infected patient with the mild symptoms, were able to be treated by creating a separate treatment track for these young patients with the mild symptoms. Secondly, by interpreting the medical law flexibly, the phone medical consultation and prescription was allowed to some extent. And up until now, over 300,000 patients use the phone consultation and prescription service. For chronically ill patients who need to have their medicine prescribed regularly, it is convenient for them, but at the same time, it was a good measure to prevent the possible transmission of the virus. And when it comes to developing diagnostic kits, proactive and prompt measures were taken to launch the kits early. And in securing the reagent, the government guaranteed the purchase of reagent from small reagent manufacturers. So without having to worry about the sales channel and profits, these small reagent manufacturers were just able to concentrate on producing the kits. And as per governance, under the leadership of President, KCDC has been the control tower in the nation's battle against the COVID-19. And the quarantine support has been provided by Prime Minister and initially by the Ministry of Health and Welfare. So 2 headquarters were established, and ever since they were established, they are still running 24 hours a day, 7 days a week. Other government agencies and municipalities, public officials are also working tirelessly. And I believe all of these have contributed to mitigating the outbreak. Through such measures, and we also shared information transparently, and every morning, through the briefing, that in addition to the people that you see on the screen during the briefing, there are up to 3,000 public officials who are connected online in real time every day to share the detailed measures taken by each government. And the discussions are made every day online, and the decision making has been really fast. And through participation and communications, measures have been taken by the entire government body. Such dedication and such governance structure has been in place for the last 5 months, and whether we can sustain such structure for long is now questionable. And Korea, in partnership with the global community, that we need to respond better to the COVID-19. And through special entry quarantine approvals, the needed international trade was allowed. And we also allowed the Chinese students entry into Korea after careful consideration. And there were some social issues revealed related to nursing homes and nursing hospitals. So additional support has been provided to such facilities. And the public support and understanding was obtained to invite them to cooperate voluntarily. So based on mutual trust, that the Korean government was able to not lock down everything, but still was able to respond well in the battle against the COVID-19. But we still have many challenges lying ahead. As per global cooperation, there are many questions on WHO-led measures to curb COVID-19, and there are some issues related to migration workers and sexual minorities. And the battle is ongoing. We're not sure whether we're in the middle or the first half is over. We might be still in the beginning of a long tunnel. And I think we're just seeing a small glimmer of light that is coming from the end of the tunnel. There are many challenges lying ahead. And the imminent challenge is that there might be the second wave. So we have to complement the quarantine measures. And for efficiently prepare the healthcare professional and medical facilities, we should give them prepare for the possible second wave. And secondly, that we should also be able to block the inflow of infected cases from abroad. And by connecting with the local resources more efficiently, we should be able to respond better in the battle against COVID-19. There are many challenges, and of course, despite some of the good evaluation results that are made on Korean government's response to the COVID-19, but I feel like we have more challenges lying ahead. The medical resources need to be secured as much as possible. And also, we need to mitigate the further spread of the virus so that we can give the healthcare professional and hospital some time to rest. The public officials at the government agency, at KCDC, at the Ministry of Health and Welfare, we should give them some governance structure or some time or some better capacity to prepare better if there is a second wave of the COVID-19. So for example, how we will utilize the untapped medical care or the treatment or vaccine. In developing the treatment or vaccine, how are we going to utilize the clinical data that we have? By utilizing all of such resources, that we will be able to better respond in the battle against the second wave of COVID-19. Thank you very much. Thank you very much, Vice Minister Kim Kang-nip. While looking at the video of the presentation, I was a bit overwhelmed. For the last 5 months, they have been really showing the dedication and so much effort. But he's now presenting with such a calm manner. It was a really touching presentation.